Hello everyone, welcome to another session of Neuro Awareness. In this session, on the occasion of World Stroke Day, we shall briefly speak about stroke. So what is stroke? Stroke is a medical term. In normal terms, it is called as brain stroke or paralysis. So what stroke is defined as a sudden onset of focal neurological deficit. So what does it mean? It means that there is a loss of function, sudden loss of function of one arm, one leg, one half of the body, all four limbs, one side of the face, sudden difficulty in production of speech, sudden loss of balance, or sudden difficulty in vision or double vision. So who are at risk for developing this stroke? People aged more than 40 are generally at risk for developing stroke, and this is a non-modifiable risk factor. So what do we have in hand so that we can modify? So the modifiable risk factors, 5 most important things include tobacco addiction, alcohol addiction, uncontrolled sugars, high blood pressure, and high cholesterol. So these are the 5 things which we have in our hand, which we can modify so that we can prevent ourselves from getting stroke in future. So how do you recognize a person is having stroke? Suppose if you're sitting in an auditorium and a person is suddenly started to have some disturbances. So you want to know whether the person is having stroke or not. So you remember this acronym BFAST, B-E-F-A-S-T. B means sudden loss of balance. E refers to eye, that is sudden loss of vision in one eye or both eyes, or sudden onset of double vision. F refers to face, that is sudden asymmetry in either side of the face. When the person is speaking, when the person is laughing, you see that one side of the angle of mouth is deviated to one side, it refers to asymmetry. If it is sudden onset, then it can be a manifestation of stroke. A refers to arm, that is sudden loss of function on one arm, one side of the body, all 4 limbs. It can also refer to sudden onset of sensory disturbances in the form of numbness or tingling on one side of the face, one side of the body, on one arm or one leg. S refers to speech. So sudden onset of change in the speech of a person can also be a manifestation of stroke. And T, last but not the most important thing is T, that is time. So time is brain. So when you see a person who is suffering from these symptoms, you have to immediately rush him to a nearby comprehensive stroke center, because I repeat again, time is brain. As soon as the patient reaches to the nearby emergency room, the earlier he reaches, the earlier the treatment would begin, and the chances of him to recover a normal life would be early, that is faster. So it is proven that the best results would be achieved if the treatment is started within 3 hours of the onset of symptoms. Reasonably good recovery can be achieved if the treatment is started for up to 4.5 hours. And due to the recent advances in the medical field technology, there have been interventions which have developed, which can be used for up to 24 hours after the onset of symptom. But after this 4.5 hour window, the treatment would be different. The lot of eligibility criteria patients should satisfy, and it also depends upon the radiological extent of the damage to the brain that the patient has already suffered from. When we come to the prevention part of the stroke, a lot of people ask, mostly the relatives of people who got admitted along with stroke, they will be asking like, what can we do to prevent the patient from having a second stroke, or what can we do ourselves so that there's a family history of stroke. So what can we do to prevent ourselves from having the stroke? 2 things. Most important things is, first is lifestyle modifications and use of regular medications. Lifestyle modifications: eat healthy, avoid high cholesterol food, avoid fast foods, use regular exercise for up to at least half an hour a day for at least up to 5 days a week, and avoid alcohol, avoid smoking in all at any circumstances. And if at all you are suffering from diabetes or hypertension, you will have to control your blood sugars, blood pressures regularly. Use medications prescribed by your doctor regularly. Thank you.